informational picket. Unfortunately, Allina is not willing to negotiate with us very well this year. And we are all out here because we are very concerned for quality patient care. And with all of the cuts and the low staffing that they are putting us through, we are afraid for our patient safety and for our own safety.
And we all trying to do our best to make this hospital better, but it's very hard for us to work like this, understaffing. Sometimes we have one nursing assistant taking care of the whole floor, whole mother-baby unit. And sometimes day evening we have one nursing assistant taking care of 48 patients.
We have been short-staffed in my department for quite some time now, with very little plans or discussion on how we're going to fix the problem. Lots of work that we have is not assigned specifically to anybody, which means that it goes undone. And also, when you're short-staffed, things that are supposed to happen don't happen, and so safety checks that are supposed to happen don't get done. Things don't get cleaned the way they're supposed to get cleaned. I have pieces of patient care equipment that I have to go and clean in my downtime, if I find any downtime, because nobody else is cleaning it.
Administration has presented that they want flexible scheduling, meaning people will have to work 10 and 12 hours. So there is also that fatigue and safety in that.
Yesterday in negotiations, Allina made it perfectly clear that they are not interested in renewing our subcontracting language, our outsourcing language. So today we are here to let Allina know that we are saying no to subcontracting, no to outsourcing.
We have tried to work with them to come up with language that we could both agree on. They're not interested in working on any kind of subcontracting language at all, insisting that we have no reason to fear for our jobs. We have many reasons to fear for our jobs. Allina has subcontracted out management in the cafeteria. They've subcontracted out management in housekeeping, and it has done nothing to improve the quality of patient care. And if anything, for instance, they subcontracted out the management for housekeeping. This hospital is dirtier and filthier than I have ever seen it.
The car can't move without the wheels. We are the wheels to move this big hospital. Right? When we fight, when we fight,
this fight is not just our fight, it is a fight against the corporatization of healthcare, and we're the ones to make it stop. I bring the well wishes of 185,000 nurses across the country with us. They know that you're out here and they're in solid support. Some person, some standard by said, how come you red guys are in there with all that purple? Now our response is, where else would we be? Rose said it best, your fight is our fight. We all do better when we all stand together. And with standing up alongside you as co-workers, as fellow healthcare workers, they cannot win.
so we have to stand up. When we stand up, we'll win. We stand, we'll win.
Today, my union brothers and sisters and I are out here trying to get the attention of Allina Health executives to let them know what is going on inside our hospitals. We have let them know face-to-face, we have let them know through emails, we have let them know through meetings. They don't seem to hear us.
I would hope our management would be taking note of our determination that we really would rather not be doing these different activities. We would rather be at our jobs and going on with our lives. But when it comes to this kind of principles in our contract, we have to fight.
I hope that when I go back to my job in a couple of weeks that maybe management will come to us and ask us for some ideas for how we can make improvements around here, and maybe we can work together to provide, the patient care that people deserve.
We never give up till our thing be resolved. This is our second home, and all these coworkers, my family, and I will stand up for them, and they will stand up for us too.